Hi everyone, my name is Kylie Furtado and I did my honors thesis on disparities in stroke knowledge in underserved populations. I thought it was important because stroke is one of the leading causes of death in Americans and it's on the increase, with 1 in 4 people around the world being able to experience stroke in their lifetime. Strokes can have significant complications with management of stroke as well as long-term disabilities from stroke. So medications being costly as well as potentially years of rehabilitation. While its prevalence is significant nationwide, some groups are more affected than others, specifically ethnic minority populations. These populations are also populations that have the lowest knowledge levels of stroke. Even though knowledge levels are low overall, these ones in particular are the lowest. I wanted to use the health belief model to guide measurement of stroke knowledge and perspectives in a diverse community in South Coast, Mass. So my research question was, what are knowledge levels of stroke symptoms and risk factors of stroke in an at-risk population? I had IRB approval and I went to the Greater New Bedford Community Health Center. I surveyed 25 participants and I did this using Kathleen Ennen's Stroke Recognition Questionnaire, SRQ. Scores had the ability to range from a 0, meaning they got none right, to 40, meaning highest scores indicating greater knowledge levels of stroke. My results. So my sample was about 68% female and a mean age was about 57, 64% white, 20% Hispanic, 8% Black, and 8% other. Health insurance was primarily Medicaid, about 44%, and most made less than $14,000 per year, 44%. So knowledge levels, these in the middle, these are my results. And right here you can see symptoms that were on the survey and then risk factors. The ones in red are distractors, so they're not related to stroke. And participants had to check off which ones they thought were related to stroke. So mean score for proper identification of stroke symptoms was 14.36 out of 20, and for risk factors, it was 13.35 out of 20. Total scores was about a 69%. So knowledge levels, there was a deficit there. And this coincides with numerous studies showing that low knowledge, it's important because low knowledge could link to inadequate and untimely stroke intervention and higher risk for long-term disabilities. And 80% of strokes can be prevented. So it's important to know your risk of having a stroke and take actions into reducing your risk of having a stroke. Preventative strategies and educational campaigns should be targeted towards areas of disparities like people of low income, of Black race, of low educational attainment, not being able to have transportation to healthcare facilities, stuff like that, and using health management theories like the one I did to study how knowledge translates to behavioral changes. Primary prevention is of course important, and that's why I think education regarding stroke can definitely be improved and targeted towards areas that have high risk factors. Thanks for looking at my poster.